Dear friends, welcome to my Geriatric Medicine channel. I am Dr. C.J. Keshavamurthy from Shumaga, a geriatrician practicing geriatrics. Now, today we shall think about or discuss about heart attack in brief, it is not a detailed description. So, let us know what is heart attack. Blood flows to the heart through three blood vessels, enabling it to function normally. All the three blood vessels originate from the aorta. As soon as it goes out, exit from the heart. As one grows old, the blood vessels constrict and a good deal of fat is deposited in them, obstructing the flow of blood and finally resulting in the heart attack. So, heart attack is the constriction or the obstruction of the coronary heart arteries. These three arteries are called coronary arteries. There is one special thing about the heart attack in in the elderly people. It is the silent heart attack. The development of heart attack without chest pain is called silent heart attack. As you know, in middle-aged people, the heart attack is very severe, and the pain is also very severe. Sometimes the sweating, vomiting, etc. also takes place during heart attack. But in elderly people, there may not be any chest pain at all, and it is called silent heart attack. And the other features like sweating, etc., also may not be there. As one grows older, nerves become weak and ineffective, and the patient loses the sensation of pain originating from the uh, heart. That is, the part which the heart attack has taken place. From that part, the pain won't be received and felt in the brain. Silent heart attack is more common in diabetes. Diabetic people, the nerves will become weak, and so they suffer from the silent heart attack many times. Then let us think about how do we know that we are going to have heart attack in nearby future. If any of the following risk factors are there, then chances of getting heart attack are more. If any of these risk factors are hypertension, the blood pressure which is above 140 by 90, very high cholesterol more than 300 milligrams per ml dl, life of stress and strain, always patient is suffering stress and strain, lack of physical activity. If the patient is very sedentary, always sitting idly or sleeping, such patients will get or shall get the heart attack. If there is a family history of heart attack, the chances of getting heart attack in the elderly are more. The obesity or overweight, if the patient weighs more than 80 kgs, 90 kgs, then the chances of getting heart attack is more. Diabetes, as you told you, diabetes also a major risk factor. The smoking is also a major risk factor for getting diabetes. If all the risk factors are present in the person, then the elderly person may suffer from heart attack in future. If any of the above risk factors are present, it is advisable that one should undergo treadmill test. Treadmill test is a test in which the patient has to walk slowly and then run over the machine for nearly 10 minutes. And ECG will record all the abnormality of risk factor strain. And then stress thallium test, which also will indicate whether the individual is prone to development for the development of heart attack or not. In old age, which is the best treatment for heart attack, medical or surgical? This is the question. Patient will often will be in a dilemma whether to undergo medical test or undergo a surgical treatment. Medical treatment is the best for uncomplicated, mild to moderate heart attack. In cardiac catheterization, if cardiac catheterization reveals the presence of block of one or two main coronary arteries, that is called angioplasty. Then the angioplasty is the treatment of angiogram, it is called angiogram, and angioplasty is the treatment of choice, in which the patient is the vein, good nerve from the leg is taken, and some bypass surgery is done between the blocks, surpassing the block. A patient who is refractory to medical therapy or when the angiogram reveals multiple blocks, then coronary bypass surgery can be contemplated. The symptomatic and functional improvement of the elderly survivors of heart surgery is almost uniformly dramatic. In one or two coronary arteries are block is there, then a stent, metallic stent can be placed and the patency of the artery may be restored so that the blood flow through the coronary arteries will be restored and it will become normal, the pain will disappear. Dear friends, this is in brief about the heart attack in elderly people, in which we should know that there is an entity called silent heart attack. Patient won't know about the occurring heart attack or the heart attack which has occurred a few months back or a year back. They won't be aware of it. Only laboratory tests, treadmill tests, etc. They will reveal the heart attack which has taken place earlier. Friends, this is in brief about the heart attack, and I request all of you to go through this information, like it, share it, and pass it on the benefit to your friends. Thank you very much. I am Dr. Keshavamurthy. Jai Bharat, Jai Karnataka.